We are in rural Uganda at the Kissito Hospital, and Dr. Sabiiti is here with a rather interesting patient in October of 2011. Can you just tell me what you found and what you did for this woman?
Yeah, this woman was admitted 3 days ago with sort of a swelling, epigastric swelling that has gone close to 4 months, but it had recurrent pain. Later on, when she came, we evaluated the patient and made a diagnosis of lipoma because the features on local examination could point to a lipoma. However,
a lipoma.
However, something weird was the presence of pain, of tenderness, and that one gave us a little bit of confusion because we don't have ultrasound to find out exactly what happened. So on going in for a surgery, we excised the lipoma around, and then later on underneath the lipoma we found a pocket of a defect of a hernia, epigastric hernia. So what we did is to excise off the lipoma completely and then reduce the viscera and then repaired the defect.
And some of the hernia had herniated into the lipoma as well.
Yes, it had actually herniated through the abdominal wall, then made a pocket, a cystic pocket in the lipoma.
Tricky surgery.
Popping into the lipoma and then coming at a given time it could get obstructed and giving
and was it did you say it was an umbilical hernia or elsewhere, lateral, or
it was supraumbilical?
Supraumbilical,
but close to the epigastrium.
Oh, okay. Okay, I know exactly. That tells the audience. Pretty. And you described yourself as what kind of doctor? What is your training?
Well, I am a doctor who has a MB-CHB, Bachelor of Medicine, Bachelor of Surgery, attained from Uganda. And I have done other trainings, clinical trainings.
And you call yourself, I believe you said you were a general practitioner.
I'm a general practitioner.
You're trained as a general practitioner.
Yes.
And that training includes a good bit of surgery.
Exactly.
Yes.
Yes, includes surgery.
And what are some of the other surgical procedures you have done and can do? You've done how many C-sections?
I have done over 2,000 cesarean sections. I have done over 50 to 60 hysterectomies, actually total hysterectomies, and a number of subtotal hysterectomies. I've done a number of laparotomies, including bowel surgery, where there is the intestinal obstruction with the ischemic gut or necrotic gut, where you have to do anastomosis, primary anastomosis. I've also done, splenectomies.
I had my spleen taken out by a GP.
Okay.
3 GPs. Yes. First one they ever did, but it's unusual in America.
I have also done pelvic tumor extraction, plenty of them.
Pelvic what?
Tumor.
Pelvic tumor?
Yes. Like ovarian tumors, I've done it. And, in this part of the country we have cysts, huge cysts. Like of recent, I removed a tumor of close to 8.4.
Do you ever... anything in the chest?
Well, in the chest, the only surgery I've done on the chest is a tube insertion of a tube to drain, say, to relieve a hemothorax or a pneumothorax.
And what about, you mentioned, you ever done burr holes?
Yeah, that one, I do it comfortably.
Comfortably?
Yes.
Really?
I can do a burr hole.
Yeah.
And by the way, I can also improvise. Without using the burr hole tools, I can improvise and do a burr hole safely even right here where we don't have the borehole tools.
How do you do it?
We have. I go to the theater. I look for any instrument that is having sort of a screw.
Yeah.
And then there is a way you manipulate it. Then, poof, there is a way you feel and say, yeah, I'm in it, and see blood gushing out. Yeah. And that's it.
Fantastic.
Yes.
Thank you.
And at one time I used a spanner. A spanner?
Yeah.
A star. They call it what? The star, some kind of, it has a star end.
Yes, right.
So I use that. But it's not easy. But no. I've used it once.
Terrific. Well, thank you very much. She's very lucky, and you're very skillful. People will really enjoy it. Thank you.
Thank you so much.